Good morning. I'd like to call the January 13th, 2014 Human Services Committee meeting to order. I'm looking for an approval of the agenda.
Move to approve.
I do have one addition as letter G on our agenda. I would like to add Community Action Agency's report. Any other additions, deletions, corrections? All in favor say aye.
Aye.
Opposed? All right, so we have the agenda. Under public comment, any individuals that would like to address the board, you have up to 5 minutes to do so. Is there any public comment? Moving on, we have the minutes of the December 9th. Human Services, we have a motion to approve.
Support.
And we have support. All in favor?
Aye.
Opposed? Moving on to the animal shelter, the fourth quarter report. I see Don.
Good morning, ladies and gentlemen.
Good morning.
As this is my first quarterly report to the board, please excuse any nervousness or possible omissions. My start date was first week of November. Obviously, I was only here for 2 of the 3 months of the final quarter. I'm assuming everybody has a copy of my report. If not, I do have a couple extra copies. With that said, I'll just get right into it. I would like to bring special attention to the Friends of the Animals for the Jackson area. They've been a great help through the years to the animal shelter, and they're continuing that help, as I will get to a little bit later. But they are the sponsors of Pets for Vets. We have had 3 of those events, the most latest one in November, of which we were able to adopt out several animals, I believe 7 dogs and 5 cats, or vice versa, for a total of $1,040 reimbursed by the Friends of Jackson County Animals. We also did the first of another fundraiser in December, what was the official? Holiday Pet Pictures. Though it wasn't a resounding success, but we learned quite a few things, and we plan on doing this again next holiday season. We are anticipating maybe converting it from a Christmas to a Halloween themed, or both. Since we get the dogs and the cats into outfits, it seems like a logical thing. We're going to build upon the success that we started. As I mentioned, Friends of the Animals for the Jackson area, they are contributing some dollars, $6,000 to be exact, to our current drain reconstruction project that's undergoing as we speak. That project got started last week. The floor drains in the dog shelter area are being reconstructed, and $6,000 was contributed toward a total cost of about $15,000 plus or minus. We had the pre-construction meeting. The furnace in the back building, which is where we're temporarily housing the dogs for this project, was gotten up and running by facilities. Facilities has been great. I want to give them some kudos as well during this project. They're organizing, doing the construction management. They got the back building up and running for us, so it's usable. We have heat. We don't have water, but that's another issue down the line. We are running temporary with hoses to get water on a daily basis. I am also in the process with Dr. Anderson to update our policies and procedures manual at the shelter, anticipating that being a several-month project, hopefully completed by June. As everybody knows, the animal control officers are no more as of January 1. Mike Overton did provide a plan to the police chief's meeting back in December. We are willing, the animal shelter is willing to transport animals from the law enforcement officer agencies on a Monday through Friday during normal business hours as an option for them to help take some of the load off, because officers are going to be doing largely the role of the ACOs, which they've always partially have done anyways. Only Columbia and Napoleon Township agencies seem to be interested in that. At this point in time, we have not had any requests from any agency to transport an animal. As well, another thing that we're planning on doing is contacting and getting additional after-hours veterinarian help, and also having in clear detail what they can and cannot do as far as animal care at 3 o'clock in the morning, for instance. And probably the most important part of the whole report, if you take a look at your graphs, the main point to take from here is slowly but surely our intake numbers have been decreasing for both dogs and cats over the past few years as part of the increasing effort of spaying and neutering. And by consequence, our euthanasia rates have started to decrease too. It's a long-term project. We're going to continue this. We're anticipating seeing the numbers to continue this downward trend. So with that, that is my final quarter report. If there are any questions, feel free. Thank you very much.
What comments or questions?
Good morning. I represent Napoleon and Columbia Townships. What provisions are there for the picking up of animals from those police departments?
Well, we would, both Napoleon and Columbia Township have cages, and they, if they bring in a dog after hours, for instance, a stray animal or some altercation that one of their officers had to go out on, they just need to contact us, and depending on what's going on at the shelter at that particular day, we will send someone out to come pick the animal up and bring into the shelter. Every other law enforcement agencies, the City of Jackson, the Sheriff's Department, some of the other agencies, they all have the option to come in after hours. They know how to get the key. They know the process. They've been doing it for years. And they can just bring the dog in at 3 o'clock in the morning if need be. And they know how to do that, and they know what intake, what forms to fill out. So that's generally the process.
Okay, you said after hours, so how about during hours?
Oh, yeah, they can, well,
Request the
if we
same
get,
service?
yeah, if we get a call from Napoleon or Columbia, and it's, say, 11 a.m. on today, depending on our staffing, it's possible we may have 1 or 2 staff gone due to sickness or whatever, we will get to picking that animal up as soon as possible. If not that day, then more than likely the next day.
Okay, thank you very much.
Sure thing.
But just to clarify.
Yes,
Government agencies,
yes.
just because-
Absolutely.
Thank you.
Hi, Don.
Hi.
Let everybody know I've been on the Sanitary Board of Appeals for about 3 years now, and of course we've never had to go to an appeal hearing. But now since Don's here, I have to go to one. So thanks a lot for that, Don.
Oh, you're quite welcome.
You're welcome. I do.
Forward to seeing you on Thursday.
Oh, well, I look forward to it. Had nothing better to do at 5 o'clock. Anyway, all of us have, at one time or another, received an email or individual email pertaining to the animal control officers no longer being out there on the streets as of the first of the year. We specifically received one, or I know I did, I think we all did, in regards to the temperatures when they got so low, the winds, etc. And according to these people on this email, according to them, they only knew of one animal that was picked up because of the extreme temperatures. I really don't know if that's actually true or not, but that was part of the email. So their concern was that because we don't have animal control officers, that with this cold weather, a lot of animals were not picked up like they were in the past due do you have anything at this point that could tell us from the time that we had animal control officers to now if it was any difference?
Well, I do not have any hard data. Anecdotally, all I can say is the officers across the board in Jackson County are well aware and well trained in animal behavior due to the fact that Cascades Humane Society went out starting in possibly October, but definitely November to December, and provided canine behavior training across the board to all police agencies. Everybody was aware that the ACOs were going to be discontinued. That training went in across the board, as I mentioned. A press release by our shelter did go out prior to the cold snap, and for the public to look after animals in the cold weather, along with an announcement of our drain construction project. The officers traditionally and historically, and then I got this information from Under Sheriff Kuhl, on a yearly basis, anywhere around 7,000 911 cases are associated with animals somehow, some way. Of those 7,000 cases, plus or minus, approximately 60% of them were handled by the ACOs, which left the other 40% to be handled by officers, patrol, or deputies or otherwise. So it's not like this is just cut and dry, the ACLs are gone and now we're putting something on the officers that they haven't done before. They have dealt with animal cases all along. So they are well versed, and so I would say that during the cold snap they were well aware, and if stray dogs were seen they would have been brought up. And we did have several, dogs come into our shelter, and they have been coming in, and as of last week we had a few come in too. So anecdotally I would say it's status quo. Everything is pretty much the same as it was before, except there are no ACOs. There's probably is an increased load on officers and deputies in general.
All right, thank you for the feedback.
Sure thing.
What other comments or questions might you have?
Well, thank you very much.
Thank you, Don.
Looking forward to another quarter, end of March.
Next on the agenda, we have the Health Department monthly report. Richard?
Good morning, Commissioners. Good to see you. Well, we've had a busy, certainly last 30 days at the Health Department. I think our report probably reflects that, and I want to highlight a few things in it for you. I indicated that, in my December 27th dated report that it is the season of helping, and we do like to help our fellow folks out at the Health Department. We actually organized a little fundraiser collection for one of the county employees that needed some assistance with her family, so we were really happy to do that in the HSCB. We had our employee appreciation breakfast on Wednesday, December 11th, and went very well. We do that on an annual basis, and this particular time we actually introduced staff to some leadership and communication training that will occur in January and February. One has already occurred in January and was very well attended and was very valuable for our staff. I think it helps us to continue to build our high-performance organization. I've probably updated you a number of times about our accreditation status with the state accreditation review that took place in October. We did receive a post-accreditation letter in December that basically indicates that we achieved MET status on 100% of the 123 indicators that are applicable to us, so the chairman of the board should be getting a letter shortly from the state and MPHI along with our certificate of accreditation. We have lots of contacts with folks on a monthly basis at the health department. Sometimes they're initiated by us, sometimes by others, but we were happy to meet with some Albion College representatives recently about additional internship opportunities with some of their staff and their students in their programs. We thought it was very nice. We learned some things about Albion College we didn't know about in terms of they have people there that are interested in public policy type internships as well as environmental and personal health services. So we're very pleased to be able to partner with them in the future. It's good for students, it's good for us, it's no cost, a little more work for us, but in the end, we probably get some progress on projects we might not normally get to when we get internships on board. The Center for Family Health approached us for entering in some referral agreements with them for purposes of their fairly qualified health center status. It wasn't a requirement from the health department, but the center needed it to support their status for their upcoming review. We were happy to do that. We don't need a referral agreement for environmental health or personal health or communicable disease services at the health department, but it was helpful for the center to enter into those with us, and we were happy to help them really have a very successful audit and review with their reviewers, and they met all 19 of their audit measures, and it was, I think, because of our assistance with them as well. Health integration is moving along. We had planned to provide some training and orientation for JHN staff in January. We just couldn't make it work in January, so we moved it forward to February 19th, so that's being scheduled and developed as we speak. And I'm continuing to work with JHN staff and their care coordination staff and Lifeways as well on doing some network capacity evaluation on behavioral health in the community. Emergency preparedness, I'll drop down to that. We had incident command and general staff. The health department participated in a state Office of Public Health Preparedness exercise, and this really was about testing our ability to use the inventory and management system that the state maintains for getting antivirals or vaccines or medications shipped to Jackson County to meet the needs in the community for an event. So that went very well, and we were successful in that exercise as well. There's quite a bit of information in my report about influenza. It is the season. We've had quite a bit of press interest and inquiry concerning influenza, and rightly so. Although our numbers of hospitalizations and maybe numbers of cases that have been reported to us thus far probably are only slightly above the same point in time last year. Nevertheless, I think we can do a better job of immunizing the population than we have. I think we need to kind of join forces and do a little bit more of that work together than maybe we have in the past, because anything we can do to prevent hospitalizations and cases will save us in healthcare costs. So it's all about really trying to get as many people vaccinated as possible. Although I don't think I reflected it in my report, as a state, Michigan doesn't do particularly well in getting the population immunized against influenza. We could do a lot better. I can probably share those numbers with you next month, and I'll put them in my report, but it's not more than 40%, particularly in just about every age group other than the 65 and older. And so in this particular flu season, what we're seeing also is that it's a kind of a resurgence or a continuation, if you will, of the H1N1 virus that struck nationwide in 2009 and 2010. It is covered in the current trivalent influenza vaccine, but nevertheless, it is a predominant influenza A virus that's circulating out there right now and making people ill. And so that particular virus has a tendency to attack the younger, healthier adult population between 25 and 40. So again, it's not just about whether you happen to be at risk this year. It's people are at risk all year for influenza, and it doesn't really matter what time of year it is. So we want to really try to focus on doing more outreach and education about getting a flu shot. It's also been norovirus season. We've had, and this is typical for this time of year, we've had 2 or 3 outbreaks that we've investigated on norovirus, mostly in the institutional setting. Most of them are already resolved at this point in time. There's no further spread in the community. But it is a very easily transmissible and communicable virus within an institutional setting, and once it gets in, it can spread very rapidly. But staff get these reports very quickly, and they jump on top of them, and they communicate and provide preventive guidance and information to the facilities that helps them to stop the spread internally. With respect to influenza at the Jackson County Medical Care Facility, they were using antiviral drugs there to help control that, as well as putting some policies in place to reduce visitation. So those things all help. See, I can give you an update on a couple things. You might have noticed under health education and health promotion that we had indicated that we had provisional award of a $20,000 grant for education outreach activities associated with lead poisoning. We were informed that we will be receiving that $20,000, and we're very pleased with that as well, to do some additional outreach and education work on lead poisoning prevention in Prosperity Region 9. That does involve us spending a little bit of time in all the counties. There are a total of 6 counties in Prosperity Region 9. but we'll be doing both work here in Jackson County as well as making presentations in other communities to specific groups that would benefit by knowing more about lead poisoning prevention. We plan to hire probably I think a part-time or a contract intern just for that time period because the timing is very short. It's only January through September, so that's how we approach it. I did a pretty good evaluation of the car seat safety program in November and December, and we communicated the need to talk more with Allegiance Health about how we coordinate and make that possible through the hospital and through newborn deliveries. So we're working on that as we speak. We've got another meeting that we're trying to schedule. And we have an opportunity for some national exposure with the Teen Outreach Program. As you know, we've been doing this for at least 3 years here now in Jackson County. It's very well liked and appreciated by the teens as well as our staff, and I think it goes a long way in helping us to continue to reduce teen pregnancy in the community. So we're going to want to continue to see that program grow and prosper. On the environmental health side, we think we've got a pretty good plan in place for transitioning to leachate handling, testing, and monitoring of well operations. Don and I met with Mike and Adam to talk through that, and I think we came up with a successful resolution. And so I think things are moving forward very well on that particular issue. Don and I were scheduled to meet in January with the City of Jackson Neighborhood and Economic Operations Department. Unfortunately, it was the snow closure day, and that was not going to happen, so we're now working to reschedule that. But we're looking forward to meeting with city staff. And that's pretty much my report. I'd be happy to answer any questions that anyone has.
Commissioners? Well, that was easy, wasn't it?
Thank you.
Thank you.
You're welcome.
Next, we have the Lifeways monthly report. Karen?
Good morning.
Good morning.
I am Karen Cascadden, and I'm a new face to a lot of you. Not everybody, but a lot of you, because I do the behind-the-scenes work at Lifeways and don't get to enjoy the pleasure of seeing you all meet. So this is very nice this morning to do. I found out on my way to work that I was the low man on the totem pole to come this morning. I do apologize for Mary Beth. She and Gerard Saraki are both in interviews this meeting, interviewing a chief operating officer position. And they didn't discover until about 5 o'clock Friday afternoon that there was a conflict with the meeting times this morning. So you have our report before you. You know the issues that we're dealing with, and we've got some highlights there on several issues having to do with our tenant issues, trying to fill our building, get a tenant. We have had some activity, and we're waiting for our activity report from CBRE, the leasing company. So I don't have any specifics, but there evidently have been some leads. We're also dealing with more critical needs in the capital area, and we're enjoying the relationship that we have with Jackson County Facilities as they have taken over our facilities function as of October 1st, and that's going well. And then you have the other issues about the state update, gives you information about the needs that we have to address and to bring to the awareness of legislator, several of them, the whole legislature, I guess would be a good way of saying it, in terms of Medicaid expansion and what that would mean to us if they cut the GF fund. We're still working with the county, Mike and Adam, which we thank you very much, on issues of local match and local funding. And if there are any specific questions that you have that our board members are unable to answer, I will take them back to you because we have Carl Rice and Gail Mahoney here who are our board members.
Commissioners, any comments, questions for Karen? Commissioner Mahoney?
Thank you. Just one comment. As Karen has indicated, she's behind the scenes, but she's kind of like how we feel about Delane. She is the oil that keeps everything running, and that's what Karen is at Lifeways, and she's always a joy and a pleasure to work with, and it's very good to see you this morning.
Thank you.
Mr. Rice?
I would concur with that. I'd also throw in there Adam Brown also, so as far as not only working behind the scenes, but taking care of day-to-day business. I do have a question, and this has been discussed at Lifeways and certainly some of the commissioners here. From your perspective, you know, obviously we have the local funding, we have the GF funding, we have Medicaid dollars, but unless the state steps in, obviously an infusion of $50 million or so that they're talking about, that's just a stopgap. I mean, so moving forward, from my perspective, the system is broken. And you can agree or not, but from my perspective, the system is broken. The way that the state of Michigan has this thing set up, moving forward, I can't see where Lifeways is going to be able to serve the public, especially the uninsured and people who are not insured. So I know a lot of people have been working on this, but it doesn't seem like it's getting anywhere. And if you have any suggestions whatsoever, we certainly would listen because, again, unless the system has changed, we're just going to continuously have a problem in serving people in this community as far as their mental health needs.
You were right in mentioning the uninsured and underinsured because those are the people that would suffer the most because of the general fund cuts and the disparity in funding in mental health in the state of Michigan. In fact, the report this month gives a really good outline of what that disparity is. The regionalization of the community mental health service providers is supposed to address some of those issues, and all it does is calls out that disparity because there's a 200% difference in the disparity of the funding in the state of Michigan, and we are the poorest funded. What that does is it translates to a lack of services to the uninsured and underinsured. If someone has Medicaid, they are still going to be served. But what would happen is, with the capacity that we have and the funding that we have, is the people who are underinsured or non-insured would be placed on a waiting list. And only if they met certain criteria would they actually be seen in what we would consider to be a timely manner. That is an issue. In fact, Mary Beth has met with Senator Khan and Senator Caswell on December 3rd at the Republican caucus to try to address some of these issues and explain exactly how this can be, when it happened, and go back to the history of how it started. She also has a meeting scheduled next Monday morning with Mr. Pileski. So we're making our way slowly, but the other thing that you talked about it still not being able to serve people is you have that other funding stream that addresses the local match here, which we all are aware of those issues, which has a structural deficit issue. And until that structural deficit is addressed, we will not be funded at the rate that we need to be funded at to address these issues. So you're right, and we will be calling on the county commissioners more this year than ever to address that because we're shoring up some of the funding issues that we've had locally thanks to all of your work, but we still have the structural deficit that will impact things as we go forward if it's not addressed.
This is not actually a question, it's just something I'd like to make a point of to my fellow commissioners. And many of you may already know this, but Karen helped me out. I had a friend that was not able to get services in certain places. He's a hard worker. He doesn't make a lot of money, but he has insurance. He has his own insurance. But ended up that he had to go to Lifeways Access Center. But because he didn't have Medicaid, they couldn't use his personal insurance he had, his private insurance, If he would have had Medicaid, they could have used that at the Access Center. So what ended up happening is general fund dollars were used for him to go through the Access Center, even though he had his own insurance. But if you had Medicaid, then it would cover it. From my perspective, that's broken.
That is broken. And just one final comment, that it is so appreciated that we have board members who have a heart for people with emotional, mental, behavioral health needs, because that's what it takes. We are advocating for people who are incapable of advocating for themselves, and that's why we're there, and that's why I appreciate the county commission working with us as it has, especially for the last 2 years, in addressing some of the funding issues. Thank you.
Thank you, Karen. Next on the agenda, we have Department on Aging. We have both Marcy and Kara here today. You lucked out, didn't you, Kara? She showed up.
I was in the jury room at the courthouse until things were kind of called off, so we were released. Oh, I forgot something.
You have to go back.
I have to call back. Well, it was only a week ago, we had all that snow, and it's been a while since I brought to the committee a sample of what we deliver to our Meals on Wheels clients in early November, and our advisory council members help us sort all these bags out. So these are shelf-stable meals, so that if they lose power, this doesn't have to be refrigerated. So it's things like, it's a pull top, and it has protein like beans. There's a fruit like applesauce, raisins, some kind of a dessert, like an oatmeal cookie. This one is beef stew, and powdered milk, and a couple other things that are given to seniors, and then with instructions that when meals are not delivered, it's generally when Jackson Public Schools is closed because of weather. On occasion, though, we will still go out and deliver. Like this last Wednesday, Jackson Public was closed, but we did go out and deliver food. And then it's announced on the different radio stations and TV stations. So whenever someone gets an in-home service, we do an in-home assessment, and one thing everyone gets is a red folder, and in that describes all of our home services, including Meals on Wheels. And again, that's described in that red folder, what happens if we can't get out and deliver meals. And then also we'll take out frozen meals that they can have in their freezer to use in the event that we can't deliver meals. So that's the process that we do every year in preparation for bad weather. Yes, question?
So Marcy, you take hold on to a storm.
Correct. Yep. So they receive enough shelf-stable meals for 2 meals, and then once we've been closed 1 or 2, or haven't been able to deliver for 1 or 2 times, then we send frozen meals, usually 2 frozen meals, and then we also reorder the shelf-stable meals, and then once the frozen meals are used, then we'll send the shelf-stable meals. So it just depends on how bad the weather is. But we replenish it once we know they've used the 2 meals. Yeah. And once in a while, we'll replenish it, and it works out. We deliver, we don't have any more days that we don't deliver, and so they just have the extra meals. And this is what our packaged meals look like. This would be a hot meal, and the cold meal is packaged the same, but they're deeper trays, so they can hold the sandwiches a little bit better. But this is what, there's a conveyor belt that then seals the meals. So, and then there's a side bag that has rolls and fresh fruit, and milk, that type of thing. So that's what our meals look like.
Yes.
Question?
Marcy, what's the font on those directions?
This font?
I think it's a 14, 14 or 16 if I
Okay,
can see it
good,
from here.
good. I'm just
It's a large font, isn't it?
I'm just thinking, I sometimes need a larger font, and I can only imagine it progresses as
Yeah.
with age.
Well, if it was up in front of you, I think you could read it. Yep. And with our programs, we of course have senior millage, and we have federal and state funding, grant funding. And the federal funding, I reported in November that the federal government hasn't informed the state what the amount is. So the state told the regions, just do an across-the-board cut of 18%, just to be safe. The federal government still hasn't notified the state what the amount is. I expect it will come in the next month. So we did receive less funding for October through December. That was the first quarter of the new grant year than what we originally expected, and there's a year-end budget adjustment that will go to personnel and finance. But we're doing okay. Other revenue, Medicaid waiver revenue came in more than what we originally anticipated. So we're okay. I don't expect an 18% cut. Maybe 5% at the most is what I personally expect. And Meals on Wheels is our largest program. It serves the most people. And then the second largest is the home care program, and that's the lighthouse cleaning, the bathing assistance, and in-home respite, where we hire workers to go in and do lighthouse cleaning and assist people in and out of the shower. Respite is for situations where someone's caring for someone else 24 hours a day, and a worker can go in and be with the person so the caregiver can leave for a while. What we're finding with our home care program is the level of need for service is increasing over time. And what I mean by that is, as I mentioned, we do an in-home assessment for people who get either a meal or in-home service. And part of that assessment, which is an area agency on aging tool that we use, we have laptops that the social workers go in the home and fill out the assessment. A piece of that is a service prioritization or assessment points. So that, for example, someone who has, say, $2,000 a month income, they're pretty mobile, they go out wherever they want, they still drive, they grocery shop, but it's just hard to vacuum and get down and clean the bathtub, and it's a safety issue. But they would have lower assessment points than someone who is homebound. They use a walker, they can't get their own groceries, they don't leave without assistance, and their income might be at the $2,000 or less. So they would have more assessment points. So what we're doing, looking more at, we've always prioritized. We focus on people who aren't eligible for Medicaid waiver, and people who call and want to know what services are available, and they're willing to hire someone to do that service, then we give them information about hiring someone privately. But what we're going to need to do now, in order to have enough home care worker hours to serve those with the higher assessment need, we're going to have people who have a 16 point, is what the level we've chosen. If they have 16 assessment points or fewer, they will be, and they only want homemaker. We're not talking about bathing. That will not have a waiting list. But for homemaker only, lighthouse cleaning only, we will have a waiting list for people who have 16 assessment points or fewer. And then those who have income that's above 250% of poverty, 225% of poverty, which is for one person $2,154 a month. If they have 18 assessment points or less and only want homemaker, they will be on a waiting list. So we'll keep them on a waiting list, so if resources improve and we can serve them, we will, but because they are eligible. But I've talked with the Advisory Council Committee about this, instituting a waiting list, and they understand and agree with the process that we're taking. Commissioner Rice, did you have a question? Oh, okay, I thought I saw your hand.
Right. Any other comments or questions for Marcy?
And I do have a thank you note to let you know about. Once a quarter, one of our meal routes will send out a survey, a written survey, just 5 quick questions. Well, someone sent back a note on his survey. I appreciate the meals, thank you. Being alone 24/7 is not fun, and the delivery person is always nice and knows my name. So, that's how I tell you.
Thank you, Marcy.
Okay, thanks.
Next on the agenda, I would turn this over to the Administrator Controller's Office. We have the Jackson County Medical Care Facility lease amendment. Anyone have any questions, comments, concerns for the Administrator's Office regarding this lease? Commissioner Rice?
No questions. I move that we send it to the full board.
Motion and support. All in favor say aye. Aye. Opposed? All right, this will move on to the full board. And as stated earlier, the addition to our agenda is letter G, Community Action Agency update. Toby?
Good morning. Well, I've officially made it through 1 year as the CEO, so that's like 15 years in community action time. I wanted to give you guys an update on NSP. We are approaching our deadline for that grant. March 8th is the deadline for expenditures. We have expended $850,000 as of December 31st. With obligations of over $1 million, so we're within $58,000 of our target. We do have our first purchase agreement, 328 Broad Street. We have a signed purchase agreement with an expected close date by January 31st, and that purchase price on that property was $75,000. 404 East Gulf, which is a partnership with the Land Bank and Habitat for Humanity, is underway. We have a home buyer identified. That home buyer is also doing the sweat equity and the work through Habitat, and so we'll be closing on that. We anticipate in March. 228 Broad Street is currently for sale. It's a 2-bedroom. Families of 4 with incomes of $67,700 are eligible for this program, so if you know anyone who's looking to purchase a house, please have them call Community Action Agency. We have 174 Long, which is also in Leone Township, and 1657 Foy in Summit Township. Both will be done in the next couple of weeks. We have one couple already who is pre-approved and ready to purchase. They just can't decide which one of those 2 properties they would like to buy. So as soon as they make a decision, and we have our lead clearance and appraisal, we will get a purchase agreement signed on those properties. Tax season is coming up. Community Action Agency is gearing up for our free volunteer income tax assistance program. We will provide free services for tax preparation to households with incomes of $52,000 or less. Appointments can be made starting January 21st by either calling Community Action Agency or 211, and it is a free service for tax prep. Community Action Agency also has utility assistance funds available. These funds are both for deliverable fuels, propane, oil, wood, or for metered fuels. People do not have to have a shut-off notice, they just need to be behind, and they have to be at 150% of poverty or less, which is $35,325 for a family of 4. These funds are the same funds that are being utilized for the Consumers Energy Care Program, where 40% of your bill is subsidized, and also for the Salvation Army utility assistance. So if someone is getting service from either of those programs, we can assist them. Sorry. I'm good. That was my report. Are there any questions? And that's all.
The 52,000, is that for a couple?
That's for any household size.
Okay.
What other comments or questions might you have for Toby?
All right, thank you.
Thank you, Toby. Next on the agenda, we have the claims from December. We have a motion and support. All in favor?
Aye.
Opposed? There are no other minutes to report. Under February reporting schedule, I would ask that the Administrator's Office take off Community Action Agency, as they more than adequately updated us today, and we would have Department on Aging, Health Department, and Lifeways. Public comment. Is there anyone that would like to address the board? Is there any committee member comment? Seeing none, I move to the call of the chair.